I would like to invite Mr. Vivek Shukla, who is the board member and CXO advisor for growth to different companies in the healthcare sector. Mr. Vivek Shukla is helping healthcare providers engineer growth in revenue, profits and market share since 1998. He's going to share his vision for healthcare in South Asia.
Thank you. So the first couple of slides on the overall South Asia healthcare market. As you see in the first slide, I try to benchmark with USA and UK on where the South Asia stand on various macro healthcare indicators. So there is life expectancy, there is mortality rate under 5 per 1,000 live births, there's GDP spent, percentage of GDP and the actual amount spent, and out-of-pocket expenditure as part of the total expenditure. If you see, South Asian countries are not very close to where USA and UK are in terms of spending, in terms of GDP spending, in terms of mortality rates. Life expectancy may be somewhere near UK and US, and apart from that, most of the indicators they need further improvement. Overall, on the opportunities side, we can see that there is a lot of contracting which is happening to private providers in healthcare by the governments in the South Asian region. So that's probably an opportunity for people to come and invest and operate some of the facilities. Also, to reduce the burden of out-of-pocket expenses in health, there is universal health coverage which is being announced, or there are roadmaps of universal health coverage in various countries. Countries need to increase public investment in primary care by at least 2% of their gross domestic product. With large private sector in the region, sustained engagement with private providers is important to improve quality care. Treatment advancements and government initiatives. There are certain advancements in treatment and there are certain initiatives by governments which are being taken, as well as there are opportunities in some specific sectors in healthcare, like diagnostic chains, equipment, primary clinic chains, telemedicine and emergency care, etc. Now there are challenges. For example, there are challenges in terms of on demographic and geographic scale. There are challenges in terms of the poor population that lives in South Asia versus the number of primary healthcare centers. There are challenges in terms of trained manpower, physicians, high mortality rates, and there is also a challenge on the high burden of out-of-pocket expenses. 5 out of 7 countries in South Asia spend less than 4% of their GDP on healthcare. These are some of the challenges. I'll just take one country at a time, 2 to 3 slides for each country. India is the largest country in South Asia in terms of population and area. It's also, and healthcare is one of the largest sectors in terms of revenue and employment in India. Indian healthcare sector is expected to grow threefold, CAGR of 22% from 2016 to 2022 and reach USD 372 billion from USD 110 billion in 2016. There's also an immense scope for enhancing healthcare services penetration in India, thus presenting ample opportunities for development of the industry. The hospital industry in India stood at USD 61.7 billion in FY17 and is expected to grow at a CAGR of around 16 to 17% to USD 132.84 billion by FY22. The healthcare sector in India became an attractive area for private capital investment. As we know, there are a lot of global investing firms, PE firms, HNIs, and also International Finance Corporation, IFC, which has regularly been investing in India. Recently, in about 2 years ago, 1.5 years ago, the world's largest government-funded healthcare scheme, which is known as Ayushman Bharat, was launched. It covers 100 million poor families for health insurance, which I feel is an opportunity in the current times. Public versus private sector. Now, private sector in India is quite dynamic and vibrant in healthcare. It has about 80% outpatients and 60% of inpatients. All out of the 100% people which go to hospitals, 80% of them go to private hospitals for outpatients, and 60% of all inpatients go to private sector. Private facilities are expanding in the smaller towns and cities. Also, 48% of hospitals in India are in smaller cities in the private sector. Startups have increased recently. You have areas where there are low-cost innovators. Areas regarding automation have gained importance. There are several Indian multinational healthcare companies that have growing presence in the neighboring South Asian countries as well. Medical tourism is an important part. And medical tourism is when people from different countries, from a country outside of yours, come into your country for treatment. So that's an important part of the healthcare industry in India. It has been growing roughly around 16% year on year. Indian medical tourism industry is said to be around USD 9 billion by 2020. Patients come mostly from Middle East, Africa, Afghanistan, and other neighboring countries. There's a medical visa which was introduced, so you were able to measure how many medical tourists came to India and from which country. Some opportunities and challenges: rising income levels, aging population, growing health awareness, and changing attitudes towards preventive healthcare are some of the opportunities. There's also an opportunity in R&D for international players due to the low cost of clinical research in India. There's an Indian medical tourism market, as I said, which is growing at around 18% year on year, which presents an interesting opportunity as well. There's universal healthcare coverage, as I spoke about, 100 million families getting government funding for healthcare. That's an opportunity as well. Provisions such as customized incentives for large ticket investments, things like tax holidays, duty exemptions, etc., are some of the, they make the environment more favorable. The challenges, on the challenges side, you have absence of unified regulatory framework. There's low penetration of health insurance still. Low government spending, so public expenditure on health accounts only 1.2% of total health expenditure, whereas WHO recommends around 5%. There are some malpractices and ethical issues which present a challenge to healthcare in India. Moving on further south to Sri Lanka, you have Sri Lanka, mostly the healthcare is in the government public sector. There are lesser private players in Sri Lanka as of now. The government sector operates 73% of hospitals, 93% of beds are operated by the government, and 90% of total patient admissions are done in government hospitals. High level of dissatisfaction with regard to the government hospitals is said to be there. There is a national health insurance scheme which has not been introduced, but there is a roadmap for a universal healthcare coverage for people there. About 9% of Asia-bound medical tourists go to Sri Lanka for treatment. 9% of Asia-bound medical tourists choose Sri Lanka as a destination. About 2.1 million tourists in 2018. There's rapid growth in the number of private sector hospitals in the recent years, which is a positive sign. In 2018, the Ministry of Health adopted a new policy, health delivery for universal health coverage. Also, the World Bank approved a $200 million loan to help increase the use of quality and primary health services. Supportive investment policies such as tax holidays, constitutional guarantee on investment, exemptions from exchange, 100% repatriation of profits, total foreign ownership, and on almost all economic segments. So these are some of the areas where there are some opportunities. Public versus private sector, as I said, private hospital beds are less. About 6% of all beds in Sri Lanka are owned by the private sector. About 3,000 such hospitals and establishments exist. Majority of private sector expenditure is in the western province, where 29% of the population lives. The rest of the region still doesn't have much of private healthcare penetration. International investors have expressed interest to invest in pharma manufacturing, catering to domestic and regional demand, so that's one area of opportunity. Countries such as Pakistan have cited lower cost of power and labor as key factors driving investments in Sri Lanka. What are the opportunities? Total health spending is expected to double from about 2 billion USD to about 4.4 billion by 2020 in the private sector. Demographic and epidemiological shifts, for example, aging population, increasing prosperity, education and awareness levels will contribute to elevated healthcare-seeking behavior. Lifestyle changes, regionally high levels of exposure to alcohol, tobacco, sedentary lifestyles provide a favorable environment for healthcare. There are also e-health and m-health and telemedicine as opportunity areas in Sri Lanka, and financial backing from World Bank will boost Sri Lanka's healthcare reforms. Challenges, the increase in demand for healthcare is expected to result in significant shortfall of qualified medical practitioners. This is a challenge that we see across almost all countries in South Asia, qualified medical professionals, doctors and nurses. Also, 20% of population in Sri Lanka holds 44% of income, so that means the income is concentrated in a smaller population segment. Sri Lanka has a presence as locations. It has not really reached the level that other countries are on in terms of medical tourism, so that is a challenge. There are highly politicized trade unions, which makes it slightly difficult for a business environment to prosper. Moving on to Pakistan, the IFC report observed that low public expenditure by government, lack of expansion in public health sector, increasing population, rising income levels indicate high potential for growth because there are less investment in public hospitals, but there is a demand for healthcare. So it has a high potential for growth. Government is exploring private-public partnerships. Despite unstable geopolitical situation and currency devaluation, the macro levels of healthcare are positive. There's a growing and aging population, there's rising chronic disease, and there's a growing economy, 4% real GDP growth, which are positive signs. Pakistan does not have a mandatory health insurance scheme yet. And also, when you come to private versus public, most government hospitals owned are of lower standard. However, there are private hospitals, around 200 to 400 private hospitals across major cities. Also, private healthcare spending, most of the spending in Pakistan is out of pocket because there's no healthcare scheme. So people are 70% are out of pocket, out of which 98% of this 70% is households who spend for their own healthcare. Medical tourism is still viewed as an untapped market. Opportunities and challenges. Government is slated to increase allocation to healthcare spending from current 0.6 to 3% of GDP by 2025. So there is more spending by government in healthcare which is expected. Contributing factors such as fast-growing and aging population, some of it which was spoken by previous people who were speaking as well, rising life expectancy, etc. are opportunities for healthcare. Aligned with global trend, growth in GDP per capita will sustain the healthcare spend in Pakistan. Healthcare operational spend has grown roughly 3% per annum every year. Also, the inpatient and outpatient volumes in Pakistan have grown roughly 3% per annum, which is an opportunity. Along with growing demand, hospital bed supply has also increased and has been growing at roughly 4% each year. Government plans to double the healthcare spend, launch a healthcare program, develop infrastructure, and strengthen private sector's role. These are the opportunities. Some of the challenges. One of the challenges is political connection is critical to overcome cumbersome red tapeism, pervasive tax evasion in many sectors. There's foreign investment contracts which are weak, long and protracted legal recourse in case somebody has to go that route. There's a high level of terrorism and conflicts with neighboring countries. So those are some of the challenges in Pakistan. There are about 3 or 4 more countries left. Bangladesh, interestingly, there's the public spending on health is currently about 35.3%, which is almost 1/3 of total healthcare spending. So there is a lot of spending by the government into the public hospitals. However, there is a liberal FDI, foreign direct investment regime in Bangladesh with no limit of equity participation and repatriations of profit and income. Healthcare infrastructure, it ranks 3rd from bottom in total healthcare expenditure as percent of GDP index. However, when public expenditure as percent of total healthcare expenditure is compared, it ranks amongst top 5 countries. Bangladesh has one of the highest out-of-pocket rates in the world, which about 67% of total healthcare expenditure is out of pocket, so people pay from their pocket to receive healthcare. This is more than triple as recommended, 20% out of pocket. Per capita healthcare expenditure is $37, which is lowest in the region compared to other countries. Universal healthcare, Bangladeshi constitution commits to address inequalities in access to health in rural areas, and the country joined the global community in committing to achieve universal healthcare by 2030. Private versus public. Private presence in secondary and tertiary level medical care has emerged over the last 1.5 decades. So there have been some private hospitals which have emerged, Dhaka, Chittagong, and some other cities. Local businesses and entrepreneurs from pharmaceutical and diagnostic care industries have expanded to set up multi-specialty hospitals. So pharma companies and other companies are setting up hospitals. Opportunities, the government aims to achieve universal health coverage, as I said, by 2030. So 70% of healthcare will be paid by the government. The average GDP of Bangladesh stands at around 6%, which is expected to rise further. That's an opportunity for anyone who wants to invest in Bangladesh. As the GDP will increase, wealth increases, people's healthcare spending is also likely to increase. On the other hand, the population is also increasing, which will further increase the demand for healthcare. Treatment advancement and government initiatives to increase medical services access should drive the sector expansion at a higher rate. Some challenges: there's a chronic shortage of appropriately trained human resources. As I said, that's probably the case in almost all countries. Misuse and misappropriation of resources, lack of public health and management expertise at district and sub-district levels, low budgetary allocation for health and insufficient public spending leading to high out-of-pocket expenses, inadequate and inefficient public healthcare, and profiteering tendency of the private healthcare sector. Some of the challenges. Moving on to Nepal. Now, Nepal, interestingly, has a very active participation of private sector hospitals. The government of Nepal made significant foreign investments and signs of progress can be seen in the private sector expansion, especially in pharmaceuticals, Ayurvedic, holistic healing, diagnostic centers, and hospitals. Nearly 3,000 small, medium, and large-sized commercial firms operate in these markets and invest about 18.34 million has been invested since 2009. Healthcare infrastructure, nearly 2/3 of healthcare delivery are privately owned and operated. As I said, there is a very dynamic private healthcare participation. Multi-speciality hospitals and diagnostic infrastructure are mainly constructed in larger cities. Unlike in the rural areas, if you see the demand and supply gap, you have 0.36 doctors, 1.17 nurse, and 0.9 hospital bed per 1,000 people. So this is below the global benchmark. So there is a demand and supply gap. About universal health insurance, Nepal Health Sector Strategy 2015 to 2020 provides a roadmap towards universal health coverage. Medical tourism, in terms of market size and growth, it's currently at about 120 US billion, and it is increasing by 13 to 15% each year. Nearly 55% of Nepal's healthcare expenditure are direct outlays by household as compared to global average of only 18%. So there's a large out-of-pocket element people pay from their pocket for healthcare. Significant opportunities are there in international health providers to meet Nepal's domestic demand, mainly through joint ventures with national and international hospitals. There are already a few hospitals in some of the cities in Nepal which are from other Indian and other countries. Also, there is while a number of investment opportunities exist in healthcare sector, the pharma industry, healthcare facilities, Ayurvedic medicines, holistic treatment centers, and healthcare educational services stand out. So these are areas of opportunity. Now, going on to more opportunities, there are significant, as I said, demand and supply gap in the healthcare sector, which presents an opportunity. Regulatory regime is positive, includes some international best practices, but bringing in more facilitated policies in private healthcare segment would further benefit the sector. The government is supportive of foreign investments in healthcare sector, which is the good news, allows 100% foreign direct investment in all private healthcare companies. Tertiary care hospitals, which is the high-end hospitals, and domestic pharma manufacturers are most attractive investment opportunities. Tertiary hospitals and pharma manufacturers have combined market opportunity of about 170 to 200 billion US dollars and are reported to be growing at 10 to 20%, largely driven by domestic demand and as a result of the shifting disease burden. Other opportunities in healthcare include opportunities in equipment, diagnostic chains, primary clinics, telemedicine, and emergency care. Challenges: health spending per GDP in Nepal is 5.8, which is second highest among South Asian countries. However, the proportion of government spending is 28%, while 47.7% is out of pocket, which is really very high, so that's a challenge. The hospital and pharma industry is highly dependent on import, and this increases the cost of healthcare for end users. High taxes on the service sector, including healthcare, is one of the challenges. Older hospitals do not comply with safety parameters such as earthquake-resistant buildings, etc. So those are some of the challenges for Nepal. Going on to Afghanistan. Afghanistan, most of the healthcare is NGOs and funded by various funding agencies and public and government. WHO and UN agencies are helping the government to implement the national health policy. Afghanistan's national health policy has 5 areas governance, institutional development, public health, health services, and human resources. Now, there are about 3,135 health facilities which are functional, which were functional in 2018, and ensure that about 87% of the population is within 2 hours of distance from any healthcare facility in Afghanistan. Households, out-of-pocket, and foreign donations are main sources of health revenue. That's how people pay for their healthcare. And mainly NGOs are in charge of public health facilities. Afghanistan has started on its path to universal health coverage, and there is a roadmap for it already. Public facilities dominate healthcare delivery. There are government hospitals and public hospitals. WHO is supporting an establishment of public-private partnership and upgrading 142 private health facilities in remote areas. Recently, 3 Indian health organizations have signed contracts to a tune of USD 6.5 million with an Afghan health company at the Ministry of Public Health. India has also supported the Afghan Red Cross Society program to treat congenital heart disease. About medical tourism is largely outbound. People go to India and other countries for treatment. It is estimated that Afghans spend estimated about $285 million every year for medical treatment abroad. Opportunities and challenges. Since 2003, Afghanistan's largely unregulated for-profit private health sector has grown at a rapid pace. Till about 2015, the Ministry of Public Health established new organizational structures and to strengthen the private sector. Investing in the MOPH for-profit private sector can have a large impact by leveraging private sector resources to achieve broader healthcare sector goals. In 2012, the office created by PPP unit to focus on designing, negotiating, and managing large hospital PPPs. So that is an opportunity to get into public-private partnership. Challenges: a constant and growing state of insecurity and instability presents a challenge. Suboptimal utilization of services due to poverty and distance of healthcare facilities from the main population. Inadequate access to priority healthcare services, especially in times of emergency. Reduced donor support. As I said, there is a donation which is with NGOs and foreign funds which come into Afghanistan, but they have reduced since June 2018. Inadequate domestic resource allocation. Low level of execution capacity. 2 more countries, Bhutan and Maldives. Going over to Bhutan, you have the basic. In Bhutan, the healthcare is public, so it's run by the government. There's a 3-tier system. There's a basic healthcare unit, and there's a district hospital, and then there are 2 large referral hospitals where tertiary care can be provided. Around 95% of Bhutanese population lives within 3 hours of a healthcare facility. Bhutan achieved universal health coverage by covering all its citizens with free access to publicly financed health services. So it is publicly owned, and Bhutanese nationals can take free treatment. Health financing is overwhelmingly public. It's sourced through general government revenue and organized through a single payer mechanism, so the government pays for it basically. Private sector engagement in healthcare is limited to some private diagnostic centers, generally for screening of foreign workers, and private retail pharmacies. That's the only private sector presence. Asian Development Bank has signed $14 million policy-based grant and $6 million project grant, both sourced from ADB, which will help Bhutan to progress towards universal health coverage. And since 2003, IFC also has invested close to $50 million. Bhutan depends on India for specialty health services, so people go to India for the treatment. What are the opportunities? Well, to set up an FDI company in Bhutan is fairly easy and straightforward. Enjoys a favorable location between India and China. Bhutan recently moved up 15 points on World Economic Forum Global Competitiveness Report. World Economic Forum ranked Bhutan 24th for labor market efficiency, ahead of South Korea and Taiwan, which is interesting. The private sector is still relatively young in Bhutan, which means more opportunities for investors. What are the challenges? Gaps in translating policy into practice, patients bypassing the referral system and going directly to the large referral hospitals, and bypassing the primary health centers, rugged geographic terrain, scattered settlements, inadequate public health infrastructure. Foreign buyers are barred from Bhutan's stock market. So these are some of the challenges. Coming over to Maldives. Maldives, as we know, is a scattered island, a country of which consists of various islands which are scattered. The Ministry of Health and Family coordinates and manages health sector reforms with significant support from its major development partners such as WHO and other donors such as World Bank and United Nations agencies. So it's mostly United Nations, WHO and World Bank. Geographic characteristics present a tremendous challenge. These are small islands, more than 200 islands scattered across the Indian Ocean. Each inhabited island of Maldives, irrespective of population size, has a hospital or a health center accessible generally within a 10-minute walk. So all of these islands have at least one health center or a hospital. Public integrated system is supplemented by a mosaic of private clinics ranging from a single doctor consultation to polyclinics with laboratory services, and some even have inpatient capacity. The system is further complemented by different NGOs participating in public health functions. Universal health coverage, Maldivian government introduced a policy. Maldivian government introduced a policy of universal health coverage. So there is a universal health coverage for citizens in Maldives. Public and private sector, well, Maldives had in 2018 indicates that there are 3 tertiary level care hospitals in the country. 2 of them are public and 1 is private. For medical tourism, it's largely outbound. Government, interestingly, this is the only country where government pays for treatment of its own citizens when they seek treatment abroad. So they can go to the neighboring countries like India and other countries. There's a list of hospitals that they can travel to, Sri Lanka and India, etc., and the government pays for treatment if they want to go abroad. Okay, so what are the opportunities? Rise of non-communicable diseases, which contributes towards morbidity and mortality in the country. That's an opportunity for healthcare. Government aims to provide a doctor in every island. That's an opportunity because it will strengthen the medical emergency services. Government has implemented district health information system for routine health information collection across Maldives. So that's on the IT infrastructure side of healthcare where there is some opportunity. Challenges, connectivity is poor. Most islands do not have health posts from where the family health workers can work. Health sector depends heavily on external funding for capital. Lack of skilled personnel is acute. Shortage of biomedical expertise implies that if there are major problems with maintenance and repair of equipment, and disruption of services due to unavailability of consumables and essential medicines. So this is what I had. If there are questions, if you want further details on any of these countries, or if there are question answers, only over email. All right. Thank you.